everyone who is watching and to our media members who are here as well. We want to let you know that this will work the way that we have been doing our virtual briefings in the past, which is we will hear from Eric Jasinski, the Health Commissioner, and then Donnie Miller, the CEO of Neighborhood Health Services. And we will give you all an opportunity to ask your questions at the end. So if you have questions, you can raise your hand in the chat area, and we will call on you. You'll be able to unmute your microphone and ask your own questions as we go through. So we want to bring Eric Jasinski in to the conversation. I am going to turn my video off so you all can see both of them bigger. And Eric, we talked last week, the governor and Dr. Amy Acton in Ohio decided that we were going to start defining cases a little differently, and we were going to start listing probable cases along with our confirmed cases. Tell me a little bit about how that works. What is the new case definition?
Chris, thank you. This is much like any other disease outbreak where you have a case definition. Sometimes that case definition does change because of the science and or the route that the disease is taking. And I think what we're trying to do here is capture as much information as we can from our communities. So it's just no longer just the positives that we're looking for. We're also looking at then, we call them probables. And the case definition has changed a tad bit to include some things that weren't before, because if you were positive, it was very easy. We found you. We did if you would, an interview with you, and then found your contacts, and then we made sure that your contacts were then quarantined. Well, this is going to be a little bit different. Where we're looking at those contacts, now we're going to have to delve in a little bit deeper to those contacts in the sense that probables would meet a clinical criteria. So in other words, you had certain symptoms, and we're going to get into that just a little bit here. And I don't want to get too much in the weeds here, because what's going to happen is that there's a lot of ifs, ands, whats, ends, ors. So we don't want to do that, but I just want to kind of give an overview. So it meets clinical criteria, some sort of symptoms, and then that epi-link that we've talked about, there's epi-evidence. So you were in contact with somebody, you were in an area. So again, that epi-link is still there, but you have no confirmatory laboratory results. So if this was me and I had a cough, and I was next to somebody who was tested positive, then again, I would be considered a probable. There's some other things then here too. It meets a laboratory evidence. So I'm being tested, but it might be that I am a COVID patient, but we just don't have that positive test back yet, or that test back yet. But then I meet clinical criteria. So I have a fever, let's say, and that epi-link again. And then the last thing that we're looking for is, do you have a connection to a vital stats record? In other words, someone who has passed away with a COVID possibly, or more importantly, meets the record criteria with no confirmatory laboratory test for me for that COVID-19. So again, it gets a little mushy here, and that's why we have these epidemiologists that are so important to this process, that they're actually walking through all of this. Let me talk about a little bit of the clinical criteria. I think that's important for the community to understand. We've really been looking at that fever, that cough, that shortness of breath, but we're expanding this a little bit to look at a couple other things. So clinical criteria is you have to at least meet two of the following. So again, a fever, like we've talked about, chills, rigors, malaise, headache, sore throat, or that thing that we've been talking about, that change in taste or smell. So again, two of those, or you meet one of those that we've always been talking about: cough, shortness of breath, difficulty breathing. So again, there's a lot of if, ands, ors here. I think the main thing is to understand that what's going to happen as we get more of these probables, we're going to be able to have a better idea what's going on in our community relative to the disease itself, but then have a better idea too of, again, if we have to respond to a second wave, where we've already seen clusters or increase in disease in those areas. I do want to mention one thing about the epi-link. It's really important that we get good information relative to these contacts. Because if we don't get good information, it's hard for us then to actually implement this new case definition. And also then too, you're going to see a rise in cases, if you would, because we're going to say positive cases as those probable cases. So we're going to see an increase. And this is kind of why I want to make sure that we stratify those two. So we separate them out so the community can see these are positive cases, but you're also going to see this probable case grow as well too. Which is going to be important again for us to again come out of this to recover, but then also prepare us for that second wave.
And Eric, when you are talking about the epi link here, you are talking about moving forward from this point on. You are not going backward in time, right? This is from when the governor and Dr. Acton decided to include those cases. So moving forward, when your epidemiologists are doing their contact tracing, they're going to be looking for these contacts and these probable cases.
Right now, with the need to be expedient and make sure that we're capturing everything we possibly can right now, yes, we're going to move forward from now on. If we slow down and we can try to maybe reach back into some of these contacts, again, I think what's going to be interesting too is that self-assessment that UT has put together. That's on our website. Can also be a part of this as well too. Eventually, to reach back into those individuals to see if they had symptoms and epilink. So, but for right now, what we're concerned with is getting to those positive cases, looking at those probable cases, and then moving this along.
Okay, and obviously you have a finite amount of staff members to be able to do this epidemiological work. So you also have some volunteers that are going to be helping you out, and you're asking people if they might be home and retired or wanting to volunteer in some way to join your Medical Reserve Corps. Tell me a little bit about that.
Okay, well, first off, let me talk about Dr. Dake and what he's been able to do with the University of Toledo and the students there who have been helping us out immensely, as well as some other staff. And so we are going to continue that relationship, and that's going to be very important. We're going to need them for things that are occurring now, but as well as into the future. So again, I wanted to make sure that those students and UT knows, thank you very much for the help, but we're going to need you in the future because we won't even have more of a robust response than what we have right now. So what we're trying to do is, again, add more layers and individuals that can help so that, we can maybe even do more of a detailed discussion with individuals than, some of these discussions last 15 minutes, some last 45, depending on the information. So the more volunteers we can have, the better off, again, we can respond. So what we're looking at doing is our Medical Reserve Corps, we've had now for, about 15 years, I do believe, maybe a tad bit longer than that. And they're medical volunteers that, again, can sign up and be a volunteer for us. We originally looked at this for a pandemic flu event, but more importantly, what we're looking for them to do is help us with vaccinations or dispensing of other medications during a time of crisis. Well, I think what we're going to try to need to do now is get volunteers who want to sign up for this, and those medical volunteers that can help us do these tracebacks, at least be put on a list, be trained, and be ready at a moment's notice then to help support the health department, the University of Toledo, and the students that we have, as well as then making sure that we have layers put in here that can go ahead and help us respond. I see the graphics up on the screen. Again, please, if you are specifically a retired medical professional who wants to help out, that would be great. Other medical professionals that could lend their expertise to, please volunteer. And this is a great way, again, for some of us who really want to volunteer, but maybe we can't get out of our houses, those medical professionals that can actually do this from their home when called upon. So, Chris, again, I really like to urge the community, those medical volunteers, to sign up and see where this takes us.
And let's just go ahead and put the graphic up for the survey as well, because this survey will eventually become very important data for you as you plan forward for future pandemics or epidemics like this, correct?
Yeah, it really is. Again, without the testing, and I don't want to belabor that, but without testing, we need to have other tools. And again, this community has responded so great to so many of the challenges that we've had over the last month or so. But this is another tool that we can utilize to find out what's going on in our community, and even give, like I said, relative to those possible probable cases, we might be able to even reach back and utilize this survey to help us out and look more at our probable cases as well. So again,
Okay.
tools are great. We need more of them.
Yes, and so if people are having symptoms, for instance, they should be going to that survey site, and you can reach that. And you can also, there's a link to the Medical Reserve Corps on the lucascountyhealth.com site. So a lot of great information there. You also had an influx of phone calls about businesses who may not be essential or who may not be following the regulations they're supposed to follow. Those calls have dropped off dramatically for you this week, and you are able now to do a little more investigation on some of that.
Yeah, 100% right. Again, thank you to the community who actually, made those calls to us. Again, we followed up with a call back to many of them to ask them what they were doing to make sure that they had that information. So again, understanding that this pandemic nobody has been in. So how do you actually react and what do you need to do? There was an educational curve there, and I think that again, businesses and the department and others who made those calls responded right relative to getting that information out. So now what we've been doing for the last actually probably a week or so is going out to facilities, doing spot checks to make sure that again they're doing what is asked of them. Again, we're not trying to spy on anybody, but we're just making sure that again, if there are some issues, we can help. Again, we've been asked to limit the number of customers in our stores. We've been asked to make sure that there's separation. We've done things in those stores to help them actually again decrease the possibility of COVID being transferred one person to another, and we need to keep on doing that here. But again, there are some stores that are having some issues, and so we've gotten calls about them. We've attempted to work with them, and they're still having some possible issues, and so we're going out to making sure that they are doing what we're asking them to do, and if not, we'll go ahead and help them to do that. I will let you know though that again there is enforcement to this, and we've had enforcement on certain stores, at least to the point where it's helped them understand the importance of making sure that they need to do what they need to do for those individuals in their stores to make sure they're not passing between each other, but more importantly too, for their staff and for their employees. So again, you're going to be seeing more and more of the issue of making sure that stores are doing what they need to do as we come out of this pandemic into some sort of recovery phase. They're still going to have to do things, and we're going to make sure that we give them every opportunity to get guidance and help from us.
Okay, and if you could just go over one more time, there is a recommendation that people wear masks when they're in public in those highly occupied areas where it's a little harder to do proper social distancing. This is not a law. Excuse me, this is not a law, it's a recommendation. Talk a little bit about that.
Right now, it is a recommendation, and we started talking about this almost, I think it's a couple weeks ago now. That a face covering is important, and again, not just a mask, because again, those are still in high demand for our hospitals and our first responders. So again, I'm urging everybody to use a face covering. It is recommended. And that face covering shouldn't just be over your mouth, it should be over your nose. I've seen some people, and I'm happy that they're wearing them, but it's just covering the mouth. It's got to be the nose too. Again, that recommendation is to wear a face covering while you're out in public and you're walking around. It doesn't give you the ability to, again, move into that 6-foot separation into, a 3-foot or 2-foot. What we're saying is that's an added protection. So we don't want to get lackadaisic about our distancing and our washing of our hands. As we come out of this pandemic into recovery phase, we might be seeing more and more of this with inside of our businesses. So more to come on that. Again, this is going, as you heard from Dr. Acton and the governor, this this response we're going to have just isn't going to be done May 1st. We're going to, I liken it to a breaker box where, we throw the main switch back on, but we have all those individual breakers. And so we're gonna have to start throwing those breakers one at a time or a couple at a time. We just can't throw everybody back on and expect us to not have issues with COVID. So one of those things could be wearing a face covering much more often than we've ever thought we would have.
And we certainly don't want to be put back into a position where we have to do this again and have these stay-at-home orders put in place again. Want to go over some of the new numbers now. We normally do this at the top. We're doing this toward the bottom of Eric's conversation today because we want to show you the new way you will start to see the numbers coming out, which will include new demographic information as well. So Eric and Sarah, I think we have graphics for this. So if we can just go over the numbers as we have them, these are the most up-to-date numbers we have as of about 45 minutes ago this morning.
Thanks, Chris. Yeah, local county cases 608. Again, unfortunately, we have had 28 deaths in our county. Again, thoughts and prayers out to those individuals who have lost loved ones. Confirmed, we have 579, and those probables 29. Again, we said we were going to split this out. Confirmed deaths. Again, they're not probable. They're not from the probable bucket. They're from the positive cases. That's 28, and right now 0 probable. So again, we'll be presenting this data on a daily basis, and as we go forth, we might even look to add other things. I think this is a great start for the community to kind of understand what's going on.
And those probable numbers will be growing pretty exponentially as we go through and do that epidemiological work. We have another graphic to show you our breakdown in male and female and our age range as well.
Again, 283 for male and 325 for female. And again, the age ranges from 3 to 99. Again, kind of interesting, when we first started this many months ago, we were looking at males dominating the females. It's a little bit switched in our county. So that's just an interesting little tidbit right there relative to how we're looking in our community.
And then for the first time, we're sharing racial data, and we want to show those that graphic and those numbers as well here in Lucas County.
Okay, so this is a great graphic and good numbers. However, it is really disturbing to see this. I don't think anybody expected this to be any different. It is something that we have to work on in our community because this is actually coming from a number of different issues that we need to fix in society. And I'm so happy Donnie Miller is here today to help us talk through this. So I'll just work through the numbers and then we'll get right to the conversation. If we break this down, 180 are white, 297 are black, 23 has signified as something other. And then I want to talk a little bit about the unreported is 108. Sometimes people just don't want to give the data of the race, and that's fine. Also then too, there are some times where we just cannot get a hold of somebody. So you'll see that unreported. So it's a mixture of a couple of different things, but I think this is a good start to really understand, one, what is happening in our community. But I think the better thing for public health is that this, I hope, will begin a very detailed conversation and a possible societal solution to what we're seeing on the screen right now. Because again, it is a concern.
And these are the cases. These are the positive confirmed cases in Lucas County. We also have a slide to share about the deaths in Lucas County, I believe, with some breakdown there. Oh, here is the county case count by ethnicity.
So 321 is non-Hispanic, 24 Hispanic, Latino, and then 263 unreported.
Okay, and then the death count here.
Yeah, this is again. This is the hardest part about these conversations is those individuals who have passed. Right now, we have 15 have signified that they're white, 10 black, 1 other, and 2 unreported.
Okay. So let's do then, we're going to have you turn off your camera, Eric, and bring Donnie Miller into our conversation as well. Donnie, will have you turn on your camera. And our interpreter, David, are you and Desiree going to switch out now so you can have a rest? We'll bring Desiree up here. So, Donnie, I guess, Eric said it there. It's not a surprise. We're seeing those numbers with the African American community in lots of other cities and towns across our country also. But I think, can you give us an idea of why these numbers are so much larger? Why the African American community is so much more impacted by a pandemic or an epidemic health crisis?
First of all, I'd really like to thank you, Chris and Eric, and Gretchen DeBacher, the mayor, for allowing us to have this conversation this morning. This is a critical conversation for a number of reasons, and not the least of which is that we have to get a handle on the spread in communities of color and communities where people are living in poverty if we intend to get a handle on this issue at all. Um, your question is a complicated one, but I'd like to give folks some perspective. Eric's numbers were good, a good solid reflection of what actually is going on around the country. If you take states, for instance, like Michigan and Illinois, where the African American population is 15% of the total population, but then represents 40% of those with corona, it does take your breath away. The situation is worse in places like Louisiana and southern states where the African American population is 32% of the state, but an amazing 70% of those who are infected with this virus. The reasons why, gosh, let's start with the ones that are the easiest to talk about. Certainly you find more of those underlying conditions in communities of color. For instance, some of the major underlying conditions that have been discussed include diabetes. In the African American community, diabetes is present 60% more than it's more common 60% of the time in African American than it is for other ethnicities. Um, High blood pressure, lots of folks call it pressure, high blood pressure, whatever you call it. You know what I'm talking about, is present for Black men in the African American community. For Black men, 42% more often than it is in the white community, and 45% more often in women that live in my community. So, and Eric, I know, would agree, because we see this every single year that we do our county report out for health status. Issues of obesity and those things that I've just mentioned are so overrepresented in communities of color. Of course, those things don't cause you to get this virus, but it certainly does make you more susceptible to this virus. And when you think about that, and then you think about issues in my community of environment, we live typically in neighborhoods that are denser. Certainly, the community, and I don't want to leave anybody with this impression, we are not this monolithic group of folk who all think the same and live the same and make the same decisions. That's not true at all. When you're looking at the kind of data you're looking at, some of the trends that you see in data are the fact that it arises in neighborhoods where the community is denser, the population is denser. More people, houses closer together, fewer resources, so people are going to the few resources that are in those communities. Lots of intergenerational engagement in my community. For a very long time, we have always welcomed in others to our homes to care for them and to provide for them. Um, our community is one that's tight in so many ways, especially when it comes to family connections. And so there's a lot of intergenerational um, connectivity in those communities, in our communities. So, the, you know, harder issues to get your arms around are structural issues, access to care, lack of insurance, all of the things that we've heard about time and time again, systems that are not designed to really welcome people of color into those systems. They're not designed to address issues necessarily of transportation, lack of transportation. Where are we placing the services? Are we placing those services outside of places where, areas where people of color and people who are living in poverty can get to? If you're placing it away from where I can get to, that resource away from where I can get to, you are effectively limiting my access to that resource. Where are our specialists located? Where are the laboratories located? All of those things. Where are private practices located? All of those things go directly to the ability of a community to access care, and then the ability of that community to take care of itself. One of the things I hope we get to talk about a bit later, Chris, is the implication of racism on all of this. It is an uncomfortable topic for many people to talk about, but it is a topic that we absolutely need to address. It is something that permeates the health status of most African Americans in a way that's very, very difficult to recover from and very difficult to manage. So, again, it's a complicated conversation, the reasons why these numbers are so high. The reality, though, is that they are high. And when we approach this conversation, we really need to think about not only a clinical response to this issue, but a public health response to this issue. And this is not a one-shot conversation. Whenever this is over, this COVID experience that we're all trying to struggle our way through right now, we need to continue to talk about the importance of these structural issues on the impact of people of color, of Blacks and Latinos and folks living in poverty.
So, inequities in the health system, access to food, access to healthcare, living multi-generationally in denser populated areas. Some of those things are some of the reasons why. And then the underlying conditions. And I just want to make sure, because I know we will have, hopefully some people take something really important away from this who are watching on social media today, Donnie. But people in the African American community should know, if you have any of those underlying conditions, you are more likely to die from coronavirus. And that message has to get out there, right?
Absolutely, that message has to get out there. I have the privilege of working at an organization called the Neighborhood Health Association, and we've been around for 50 years providing care to this population. And I can tell you, from what we see walking in our doors, the great percentage of people that present to us from care have one of those conditions. What we also see are people finding a way out of no way, finding a way to manage those conditions, those health conditions, in situations that are not always optimal. And they're accustomed to feeling uncomfortable. They're accustomed to, not always having the medication that they need for a number of reasons. But in this case, Chris, none of that should be allowed. If you are not feeling well, and people within the range of my voice, I really hope you hear what I'm saying here. This virus will kill you. It will kill you. It will take you away from your families. It will take you away from your loved ones. It'll cut short whatever contribution you want to have to this community and whatever legacy you hope to leave. There won't be homegoings like we know them. There won't be opportunities for people to grieve like we know them. You can't pretend that this isn't happening to us, because every single piece of data screams at you that it is not only happening to us, but it is killing us. So, for whatever reason, people will choose not to hear what Eric is saying, not to hear what I'm saying, not to hearing what so many people are trying to say to this community over the past several weeks. I want you to know you're taking your life in your hands when you do that. We have the power, Chris, and I think it's really important to say this to folks. This is not something that we need to be terribly afraid of. It's something that we need to be extraordinarily cautious about. But we have the power to stop this disease, and that depends, and that is not dependent upon what color you are or how much money you have. Eric talked a bit about social distancing. Those things, that's terribly important. Figure out a way, even though you're living in a house with lots of folks, figure out a way to make that happen. Wash your hands, wash your hands, wash your hands. Gretchen reminded me yesterday that you don't need the fancy stuff. You don't need the Clorox wipes. You don't need all hot soap and water. Wash your hands for 20 seconds, rinse them, wash them again. Wearing masks when you are leaving your house or your business or wherever you are. And they don't have to be the fancy masks. You can make them out of bandanas. There are a million those online that show you how to make your own masks. And for those folks, Chris, and I think this is really important to say, not all of us can stay home. And for those folks who can't stay home, and there are many, many people in my community who don't have the opportunity to stay home, they are, in my terms, essential providers. They're not necessarily folks working, in the emergency rooms at the hospital, but they are the people working in the grocery stores and the bus drivers and the hospitality workers and all of those people who are out there every day because they have to be out there every day. There are things that you should do. You can't get lazy about the hand washing, but you also want to go to the CDC website, go to the website on healthcare equity, which is part of the AMA, the American Medical Association. And there's a list of things that they are suggesting that you do when you're coming in from outside, having been in contact with lots of people, like leaving your shoes at the front door, like washing your clothing when you get home if you've been around lots of people. So all of those things go to say this: we certainly are having a greater impact in these communities that we're speaking about, the African American community, the Latino community, and communities where people are living in poverty. But helplessness is not an option here. Rolling into the idea that, oh, I'm just going to get it, and maybe if I get it, I'll be immune to it, it's really not an option. You have to own your power here and fight back. And the way that you fight back are the things that we've mentioned already
And then I think protecting our loved ones, right? If you
today.
have an elderly relative or somebody that lives alone that may need your help with some of those things, dropping off food, checking on them to make sure that they're not ignoring symptoms, or if they have some of those underlying conditions we're talking about, high blood pressure, hypertension, diabetes, even obesity and smoking are also two big ones right now that people need to be really cautious of. And those are some great recommendations, Donnie, that you just made there. So we want to give a call to action here. And if you are hearing this message and hearing this message from Donnie and have a loved one, a friend, a colleague in the African American community, we need to get this message out. That's correct, Donnie?
That's right. We need to get this message out. And Chris, may I take a minute to talk about messaging? if I
Yes.
could. The the way we deliver the message to people, and I'm talking to everybody out there who has the opportunity to help shape shape this message. The 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 way that we deliver messages is so important. We have to deliver messages in a way that people hear that message. We have a history of not doing that. I can remember when the only shampoo commercials you saw on TV had pictures of women with long, waist length blonde hair, sort of waving it around, and they were saying this, you should use our shampoo. Didn't relate to me. My hair is not nearly waist length, and it's certainly not straight. And so I wasn't paying attention to that message so much. So when we started talking about this disease, this virus, we really started talking about it in a way that was fairly exclusive. We talked about it being related mostly to folks who were traveling out of the country. This disease started in Wuhan and China, and we didn't talk about, and for a number of reasons, I imagine, but we didn't talk about the fact that the folks who were getting it in China were initially those low income folks working in environments that were unhealthy for them, and that spread to lots of other folks like them in China initially. We didn't talk about we didn't talk about this virus in a way that related to the population that is most at risk now. And so we have to make certain that moving forward, we are using the words and we are using the methods of engagement that we all know that speaks to the people who are most vulnerable. Not rocket science. If you don't see yourself in messaging, you're a little less apt to pay attention to it. So it's important. But having said that, everybody has the onus to make sure that they are taking care of themselves. We are working really hard in this community through a number of different vehicles to get this information out there, and you just can't pretend that you're not hearing it.
So we want to make sure that everybody knows that this particular virus, like so many epidemics, pandemics, health issues, is disproportionately affecting our African American community. It's an important message for people who are listening to this and can help spread that message. We're asking you to please do that here in Lucas County. Okay, our call to action. If you have some of these symptoms, don't ignore them, especially if you have any of those underlying conditions, because Donnie, we are seeing this happen very quickly where somebody might have symptoms that are not really severe one day and the next day they are being put on a respirator. So this is something that you cannot ignore. We have some phone numbers for you to be able to call. And so I want to give those to you. There is a 24/7 nurse informational hotline at 419-251-4000 or 419-291-5355. If you have any symptoms, if you have questions related to something you might be feeling, related to some of those things that Donnie was just talking about and Eric was talking about, please don't hesitate to call and find out what you should be doing to protect yourself. The other thing we want to share with you is our mental health hotline phone numbers, because we know this has put a stress on a lot of people out there in a variety of ways. Our Mental Health Services Board has put out an amazing program right now that is just in the short term called the COVID-19 Emotional Support Line. If you are struggling with something, if you are having anxiety, if you have and just need to talk to somebody, here's your phone number, 419-442-0580. The crisis hotline, if you feel you're in crisis, if you feel you might hurt yourself or someone else, 419-255-3125. If you are a healthcare worker on the front lines, working in fire, police, or in our hospitals or other healthcare facilities, and you need mental help right now, this is something that is a program that is supporting our local heroes, put out by the ZEP Center. These services are free. 419-841-6781. And then the ZEP Center hotline for people who might be struggling, especially with addiction, 419-841-7701. All of those phone numbers will be helpful to you. We will place them in the comments section, these phone numbers and graphics, for you to refer back to on the Facebook page if you're watching that now. And we just want to make sure that everybody is getting all the help that they need. If we could have both Eric and Donnie, who I mentioned once, but I should have mentioned again, is the CEO of Neighborhood Health Association, which has 16 locations across Lucas County and sees patients across there. We're ready for questions from any of our media members. If you have a question, raise your hand and I will call on you. You can unmute your microphone. And then if you would rather for me, if you don't have access to the microphone and you would rather for me to ask your question, you can put those in the chat section and I will ask those for you. So we'll call first on Amy Steigerwald. Amy, go ahead with your question.
My question is for Eric, for the Health Commissioner. I'm wondering if you can talk about this a little bit. So right now we're hearing a lot of different people when it comes to opening back up the state, opening back up the country. It seems as if from the health perspective, opening back up the country has a lot of risks. And I guess what is your selling point to the community on why we need to keep maintaining these quarantine orders and why we need to continue to social distance?
Great question. I think we've seen it overseas a little bit where maybe they've opened up too much too fast. Again, I firmly believe that we need to open up our community, get back to work, but we have to do it in a way that, again, we don't outpace our opening with the ability for that COVID to get in front of us. So we need to do it logically. Again, I think there's a plan coming out both in the federal government as well from state to help us do that. My thing relative to reopening is that we need in public health to make sure that we're giving as much guidance and much help to those businesses, making sure that we're adhering to things that are scientifically valid to be able to make sure that we keep that liability of that COVID from rearing its ugly head before we have a chance, again, we're hoping in the fall to react even better. So we still need to, do some things as a community, even after we open back up, to be able to make sure that we don't have a severe issue with COVID.
Do you think we're ready to open up right now?
Again, from my personal standpoint, I don't think we're quite there yet. I think we're close. We're seeing some numbers that are indicative of us being almost there, but we don't know enough about this disease right now to be able to say yes. Let's just open it up and we can start moving forward. I think too, we're not quite at that downward slope quite yet. That May 1st deadline is approaching, and that could be a good point for us to launch reopening. But again, we need to be careful as a community. And I'm not saying that we can't reopen, but we are also, I think, like Donnie said, we are all responsible for ourselves, who are responsible for the rest of the community. So we're going to have to take it upon ourselves to do some things that we're not used to doing, whether that's face coverings or maybe not having as many parties or things of that nature that we would like to do, that we are going to have to individually take upon ourselves to make sure that we protect ourselves, our family, but our community as well.
Okay.
Thanks, Amy. If you could mute your microphone back. Tyler Paley, you are next in the chat line. Please unmute yourself and ask your question.
Hi, can you guys hear me? Good morning. So I have a question, and I understand based on a conversation with Gretchen yesterday that you guys are planning on releasing nursing home numbers today. I'm hoping that's still the case. Commissioner, I'm hoping you might be able to answer this based on any data you may have already seen. Based on what you're seeing here in Lucas County, how actively is this virus spreading in these long-term care facilities and nursing homes, and how do we combat it?
Great question. Yeah, we're seeing a definite, I don't want to say issue, but a definite concern in our nursing homes. But much like our medical facilities as well too. I mean, again, this is a nasty virus, and it spreads quickly in those settings where, again, you're taking care of critical patients, where you're taking care of nursing home patients that are having some concerns with comorbidities and things of that nature. So again, it is a current concern for not only public health, but again, for our healthcare system. And you're going to hear more about this in the near future. But we at community are going to respond to these issues within inside of these nursing homes as a healthcare, a public health entity, combining and moving things forward. You're going to see in the near future, if you would, let's call it a strike team task force, a concerted effort to see what's going on in those nursing homes and figure out how we can help them better. Again, we're seeing this across the nation, unfortunately, in these nursing homes, of individuals that are succumbing to COVID, as well as succumbing as in the mortality rate, but then also succumbing in the infection rate too. And it's tough. It really is tough. But again, we know that we need to respond, and you're going to see some numbers, I think, today, both on a state level and locally, that again, we know that the problem's out there. We need to attack it, and I think you're going to be. This community should be pleasantly surprised, I guess, at the ability for this community to come together and work towards helping out those nursing homes.
Just a quick follow-up, if you don't mind. Are there any guidelines that you're already looking at, like modifying to protect these folks in these long-term care facilities?
Again, this is a virus that squeezes in every crevice, if you would. Again, somebody asymptomatic walks through the halls. We've talked about this. There is guidance out there. Matter of fact, we in public health have had several large conference calls with nursing homes. We're looking at helping them out individually as well as a group. And again, it goes back to why we needed to form this team, if you would, the team effort to respond to some of those concerns inside of nursing homes before they get way out of hand. I know the state is looking at this as well too. The idea here, though, is that nursing homes, they are strapped with having to respond inside of that brick and mortar facility, and it is hard. That's what they have. So we needed to see how we can actually open this up a little bit more to help them out with some things that they're struggling with, and again, not to their own fault, because they're doing the best they can, but they're struggling with, so that we can come together as a community and help them out.
Thank you.
Sure.
And I will confirm for you, Tyler, that you will be receiving those numbers later today in a news release also from the health department. And
Awesome.
so you'll be receiving those as well.
Thank you.
Also, to your point, Eric, this is not something new for nursing homes or congregate facilities, health facilities. They plan for these, and there are guidelines put into place that you have put into place long before coronavirus was even an issue here that they follow, right?
Again, there's been guidance documents out there. They have been attempting to plan for these things. Again, unfortunately, that population, and it saddens me every time I think about my mom in a nursing home, or when my grandma was in, how they have to react inside of that brick and mortar facility. It's hard for them, and again, they are doing everything they possibly can. We've had conversations with almost every one of them so far on a one-on-one basis, and they're doing everything they possibly can. We just have to figure out how we can help them out even more.
Okay, do we have any other questions from our media friends? I don't see any other hands up, either for Eric or Donnie.
Can I make one other point, add one other point of information?
Absolutely, Donna.
Thank you so much. I forgot to mention that for those of you who don't have a doctor or who are afraid that you won't be able to pay for a visit or a phone call to a provider, there are 2 federally qualified health center systems in town that you can contact and that will see you based on your ability to pay. There is Health Partners of Western Ohio, and their number is 833-691-4015. Again, that's Health Partners of Western Ohio. And then there's the organization that I work for, Neighborhood Health Association. That number is 419-241-5700. 419-241-5700. And again, either of those organizations will see people regardless of their ability to pay.
Donnie, are your 16 locations open right now?
We have, in an effort to get people back, to give people the ability to stay at home, to be with their families, to protect themselves, we have reduced our operating sites from 16 to 4 right now. But they are located in places that are easily accessible to large areas of our community. So there is one on the east side called Navarre Park Family Health, and there's one on the edge of downtown called, Nexus Family Healthcare. Our clinic for the homeless, Mildred Bayer, is also open. So, and we do have one also in Holland that is open right now.
Okay. So again, we will put both of those phone numbers for the Neighborhood Health Association and for Health Partners of Western Ohio in the comments section if you're watching this on social media, so that you can have access to those phone numbers. Donnie Miller, CEO of Neighborhood Health Association, thank you so much for your very candid remarks today. And we're going to get this message out and make sure that people know what their risk factors are and make sure that they are keeping themselves healthy. And want to also thank our interpreters, David and Desiree, here today, as well as our media members and our audience for watching. Thank you.
Thanks, Donnie.